Okay, I'm Rainer Heun. I'm a consultant psychiatrist and professor of old age psychiatry, general psychiatry. I'm editor of Global Psychiatry, and I'd like to present some interesting papers. This paper is from Stuhec and team, who is from Slovenia, and he is a pharmacist with a great interest in general adult and old age psychiatry. So he's talking about the clinical impact a clinical pharmacist can make on antipsychotic use in patients on quite a few antipsychotics. And this is a retrospective cohort study. And it's quite impressive because there are quite convincing interventions. So I think I'd like to just focus on the sample. This is 49 patients between, on the average, between whatever, 65 to 90. So it's more or less old age psychiatry. And so we come to the results and what these pharmacologists and pharmacists have recommended. And so when you see for an example, patient number 1, there are 4 different antipsychotics, and he tried to help to make a recommendation to streamline this, which was eventually not accepted. There are other combinations which didn't make that much sense, and these were sometimes accepted or not, or risperidone and clozapine were given in very low dosages, and this was recommended to discontinue. Same for another patient, discontinue the quetiapine use or have a bigger look at the monitoring. Some of the medications he recommended to start and then discontinue others. So there's quite a few quite reasonable changes, which, as he said, sometimes had quite good effect and made sense. So the conclusion to all of this is that the interventions a clinical pharmacologist does make sense, can help the patients, and that the interaction between psychiatry and clinical pharmacology and clinical pharmacists should be strengthened. And this is a very exciting paper, which is very practical, and I recommend to read it in total in Global Psychiatry Archives. And we hopefully bring you quite interesting papers for your simple understanding, having a glimpse, and eventually hope you might be interested to read the whole paper. If you want to publish as well with us, please look at the website globalpsychiatry.co.uk for author's instructions. And if you want to read or hear more of these videos telling you something about the different types of publications, please register or subscribe to our channel. And if there's any mistakes, just blame me. And I hope you have a nice evening and a nice weekend. Thanks, and thanks for your attention.